All right, I am so thrilled and truly honored to have Dr. Antonio Jimenez with Hope4Cancer Treatment Centers in Cancun with us today. He is the founder and chief medical officer of the facility, and I am just so happy that you're with us so we can share this important information, Dr. Jimenez.
We're going to go. I'm so excited about being here and sharing this because, you know, it's all about education. The more that people know their options and the ability to make a informed decision, well, the better the outcomes will be.
I absolutely agree. And that's my goal with this series, is to get out the information so people can make those educated decisions. I definitely did not have this information when I was helping my dad through treatment. And so as many people as I can get this out to, that's my goal. So let's start with, kind of backing up to, when was your facility founded and what principles or treatment philosophy was it founded on?
It's interesting that you mentioned about your dad, because that was sort of my start as well. My dad was diagnosed with stage 4 prostate cancer, and he was in the US. And so I needed to do something, you know, outside the box, as we say. And so in the year 2000, I started Hope4Cancer in Tijuana, Mexico, which is south of San Diego. And at that time, I realized that, you know, trained as a conventional medical doctor and having a degree in biochemistry from the University of Dallas in Texas and so forth, that I had to go beyond that. And that's when I started thinking about what are the key components that one has to address when treating cancer. Because even in 2001, there was a publication by Hanahan and Weinberg in a reputable peer-reviewed journal where he talks about the hallmarks of cancer. And then in 2011, there has been even an update to that hallmarks of cancer in that research. And basically what they said, Claudia, was that there are about 10 characteristics or hallmarks in cancer that are common to all cancers. So it doesn't matter really if it's a breast cancer, prostate cancer, colon cancer, what have you. It's going really to that core issue, those core factors that lead up to the development of a disease condition, which is called cancer. And some of them are the ability of cancer cells, for example, to form their own blood supply. That's called angiogenesis. So all tumors have that innate ability to form blood supply. That's how they nourish themselves. That's how they detox, because these are hypermetabolic cells. They need a lot of energy. They produce a lot of waste material, so that has to be eliminated. And the other one is the ability to thrive in an acidic environment, low oxygen, inflammatory conditions. They send their own growth factors. So in essence, you know, there's a whole bunch of them, about 10. And so that led me, and even before I knew all this, it led me to form the 7 key principles to cancer therapy. And to this day, now in 2018, I believe that if we don't address, or anyone doesn't address, these 7 key principles, they're missing the opportunity to having the optimal, outcome that we all want. And those are, if I could briefly mention them, it's oxygenation. So cancer cells are low oxygen thrivers in hypoxia, low oxygen. The second one is the immune system. And we know that the immune system is not only important to have at ideal levels, but also an immune system, Claudia, that can recognize the cancer cells. Because now research shows that cancer cells have developed a way where they shield or mask themselves from being seen by the immune system. So quite, an interesting phenomenon. Cancer is not a haphazard or bad luck condition. It's, as I said earlier, it's an opportunistic infection disease that thrives when the condition allows it to. The third key principle is nutrition. And this, we could talk a long time on nutrition, because what is the optimal nutrition for a cancer patient? Whether it's a keto, a paleo, vegetarian, a Hope4Cancer nutrition program. In essence, there are a few key areas within nutrition that I found in my 25 plus years of clinical experiences that we need to rotate the diet, the nutrition. Every 3 to 4 months, change it up a bit. Always making healthy choices, non-GMO, no toxins in your food, things like that. So nutrition is the third key principle. Number four is the microbiome or the pathogenic load, because we know that, the gut, that's where 75% of our immune system is, the gut-brain connection, right, that we hear so much about. So we must ensure that that gut is healthy, it's absorbing well. We hear the terms, right, Claudia, like SIBO, small intestinal bowel disease. We hear about leaky gut syndrome, all these, taglines out there. But the fact is that we need to improve that microbiome. And then there's a correlation of pathogens, be it bacteria, viruses, fungi, or parasites that are related to cancer. And not only cancer, chronic disease, whether it's arthritis, all these autoimmune diseases have a pathogenic component to them. The fifth key principle is the detoxification. We know that, we are what we eat. If we're putting in toxins, we're producing a toxic environment. So cancer thrives in this. The first thing to detox is the mind, right? The thoughts. A negative thought can kill you faster than a bad germ. And so start with mental detox. Then we go to the mouth, make sure that we have good oral health with respect to root canals, cavitations, periodontal disease, and of course, metal fillings. The next key principle is the emotional spiritual. And we know that, that this should be number one, because, the emotional spiritual is at the core level, the main factor that predisposes one to cancer and chronic diseases. For example, the right breast is related to the male side. The left breast is related to the female side. In a person that's right-handed. In a left-handed person is the opposite, but let's not get totally into that. But the right side is always the male side. So I had a patient a number of years ago who had right breast cancer. Her name is Phyllis. She was, she was doing well, but it was 1 year, 2 years, 3 years, and that lump was still there. Although she was leading an active life, she was working full time, she was, quality of life was excellent, but that tumor was still there. And then when I started learning all this about the emotional, spiritual connection with cancer and disease, it clicked that there must be a male conflict, the right side, right, the right breast. And she ended up telling me that when she was about 10 years of age, her father, her grandfather, and her uncle sexually abused her.
Wow.
Imagine, Claudia, for 50 years or so, she was carrying this. Those three persons knew, she knew, and now I was the fifth person to know. So I helped her let go of this, because it's the awareness, bringing it into the conscious mind, and then letting it go. And guess what happened to the tumor at that time? It just went shoop and went away. From a medical perspective, sometimes, I don't understand fully how this happened, but I've seen it so many times in breast cancers, prostate cancers, lung cancers, leukemias, lymphoma, where if we address and the patient really does the work, because this is not easy. This is recalling the traumas, the conflicts, the baggage stuff that we all carrying some of it around, right? So that's the sixth key principle, the emotional spiritual. And then number 7 is the non-toxic cancer therapies, because we know that in the conventional world, chemotherapy, radiation, surgery, gene-targeted therapy, immunotherapy, all those don't come without a cost, right? Whether it's in quality of life, whether it's in patient outcome. And so at Hope4Cancer treatment centers, the therapies and the 7 key principles is non-toxic cancer therapies.
I love that you have these 7 key principles, and I love that you have brought up a lot of what it's so hard to accept, which is in the medical field. And, I'm a pharmacist, I have a medical backing. Sometimes we can't explain why, there is that that spiritual connection, the emotional connection to disease. We can't explain it from a scientific point, but we can definitely see the results of addressing that. And that's where that comprehensive approach is just, I think is just so, so valuable. And we are largely lacking in that here. So I appreciate all that you're doing with that. And I love those principles, and especially the fact that you are focusing on non-toxic therapies. Can you walk us through maybe two of your examples of non-toxic therapies and how those are used to target cancer cells?
Okay, you're kind of putting me on the spot because we have like 10 different therapies, and that's why a lot of our patients come to us, because they say in one clinic, we could have what maybe we would have to go to 3 or 4 clinics to receive, right? But let's focus on what I called one of our most successful, not what I call, what is one of our more successful therapies, in the essence of utilizing light and sound. So this is called photodynamic therapy. We're using light and sound to target cancer cells. How this works, Claudia, is that, and this has been known for years, the use of, for example, photodynamic therapy. And even in the US, it is approved, photodynamic therapy, to treat stomach cancer, esophagus cancer, and skin cancers. So, and they've done a lot of work back in Russia, even in the old Soviet Union times, in China, and then us in Mexico. So sonophotodynamic therapy simply is the patient takes a substance which is natural, non-toxic, comes from organic, natural sources. This we call a sensitizer. It's given in several ways. One is under the tongue, sublingual. It can also, different sensitizers can be given intravenously, like hypericin, which you know is St. John's wort. Also curcumin can act as a sensitizer. Poly-MBA, which is another product was developed in the US actually, is a photosensitizer. So we wait X amount of time, depending on the sensitizer we use, for maximum absorption within cancer cells. So these are absorbed selectively by cancer cells. After that time, we begin photodynamic therapy, which is using laser lights of different wavelengths. So we could use red light, ultraviolet, green, blue, yellow, and even infrared light. And specifically targeting the tumor itself. This is called interstitial, or we could do it intravenously. And these photons of light goes throughout the body. They get to the cancer cells where the sensitizer was absorbed, and it activates it, or in other words, it wakes it up. In that process, it releases the cancer cells in the sensitizer. When they combine with the light and or the sound, they release oxygen radicals, O-, other words called reactive oxygen species, and those are toxic to cancer cells. So sonophotodynamic therapy is a therapy where we use a sensitizer, and then we use light or sound therapy to activate, wake it up within cancer cells, and that causes two things. One is it causes cell lysis. The medical word is oncolysis, right? And the cancer cells break up. The second mechanism is that indirectly, it upregulates the immune system. And it does that with both ends of the immune system, the innate immune system, which is the quick-acting immune system, and the adaptive immune system, which is more the long-term or memory part of the immune system. So this is a sonophotodynamic therapy. It has, different ways to administer. The beauty is that once patients are discharged from Hope4Cancer, they continue the sono and or the phototherapy at home. And this is brilliant because the patients are at the clinic for 3-4 weeks, and that's a big, aggressive, non-toxic push, but the continuation and compliance of the therapy at home, right, Claudia, is so important. Yes. For long-term results. And so they take, for example, a laser watch, which you put it obviously on your wrist, on the inner part of your wrist, where the skin is thick, there's a lot of blood supply there, thin, right, there's a lot of blood supply there, and then the photons of laser light penetrate into the bloodstream and travel to where the cancer is. So that's one of our main therapies that I'd like to highlight for you. And the second one is called hyperthermia. This is where we use heat to affect cancer cells. Heat, right? The sun is needed for life. But if we use heat at higher temperatures, we can affect cancer or abnormal cells. Why? Because, for example, cancer cells are heat sensitive, whereas normal human cells are heat resistant. We see that every day when someone has a cold or flu, they get a fever. The fever kills the bugs, the viruses, or the pathogens, but it doesn't kill the healthy cells, or else, fever will not be the best thing for us to have. So fever is a defense mechanism of the body. And if we apply temperature, high temperature externally in two ways. One is full body, where the patient lies sort of in a chamber with the head sticking out, and we heat the body to about 101.4 degrees Fahrenheit, which is about 39.5 degrees Celsius. At the core temperature, we're getting up to a degree and a half, 2 degrees higher. And so cancer cells are really struggling to survive. Besides the heat component of this therapy, in causing cells to lyse and to be more susceptible to all the other treatments that we're doing, because everything works together. Cancer cells an intelligent process. They exhibit social behavior that cancer cells do. They communicate with each other. They adapt. And so it's not only sonophoto, it's not only hyperthermia, it's all those key principles that we mentioned. So hyperthermia has also been shown to decrease ATP. That's the energy source of the cell within cancer cells. And that was even shown in 1982 in, what was that journal? I wrote it down here, the Journal of Magnet Research, for some reason, peer-reviewed journal in 1982. It showed how hyperthermia decreases ATP production in cancer cells, making it much more difficult to thrive, progress, and survive. Hyperthermia also decreases angiogenesis, what we talked about earlier, the blood supply of cells. It decreases that network of blood vessels. And then it makes other treatments more effective. And then the second type of hyperthermia, I described the full body, is the local or targeted hyperthermia. And this is, as the word implies, directed specifically at the tumor or the affected lymph node, for example, in the neck, in the breast, under the arms, in the axillary area, the groin, the inguinal areas. We could also target the liver, for example, because the liver is somewhat of a superficial organ. And so with this targeted local hyperthermia, we have the same effect of the full body hyperthermia, but of course, more specific for that location. And even in the States now, Claudia, they're using hyperthermia with radiation. And they're saying, oh, our radiation is working better. Well, of course, because of all these effects that the cancer is having on that the hyperthermia is having on the cancer cells, well, the radiation will, have better effects. Not that we do that at Hope4Cancer, but it's interesting. So yes, those are, briefly two of our main therapies, sonophotodynamic therapy and hyperthermia.
Thank you so much for sharing those, Dr. Jimenez. I think that, it just makes so much sense from a logical standpoint. And I think a lot of that gets lost in our, convention treatment modalities. And, we innately have, like you mentioned, the febrile response, having a fever to, certain infections. And it certainly makes sense that you would then translate that into treatment for cancer cells. So I love your approach, and I appreciate your overview of those two. Now, the next thing I want to talk about, and you mentioned it in your key principles, which is nutrition. And I know through my dad's experience, and then this story is not just related to me. I mean, I hear this story over and over again, is that here in the US, we are largely lacking in attention to nutrition. So, for my dad, literally nobody in the process asked him what he was eating. He could have been eating fast food 3 times a day. Nobody knew, nobody addressed it. in addition, as we're, in treatments and in the hospital in and out, the volunteers are handing out cookies, right? And so there's just literally no attention to what we're putting in our body as far as food. So can you talk us through what you do to incorporate healthy nutrition into your program?
Yes, and fortunately, as a physician and researcher, I didn't stay with what I learned in my training because that's very little. You're taught not to give sugar to a diabetic, do a lot of fiber in those patients that are constipated, and lower the salt in the patients that have high blood pressure, and that was about it, right? So what we learn about nutrition has to be after our formal training. And so I remember even my dad, when in his early 60s, he had open heart surgery in a reputable hospital in Florida at that time. And the first breakfast after quadruple bypass, 5 bypasses, 3 or 4 days later, his first breakfast was bacon, eggs, and a glass of whole milk.
Wow.
Like, wow, right? And as you said, doctors really don't emphasize the value of nutrition. And if we go back to the father of medicine, Hippocrates, he said a few things, right? He said, we are what we eat, although now I believe that's even further. We are what we eat, we are what we absorb, and we are what we eliminate. And so it's very important to ingest healthy, non-toxic, non-GMO food, but we need to be able to absorb that adequately, and we need to eliminate. So it all comes together as part of the nutrition package, if you will, right? And what else did he say? He said something like, let food be thy medicine and medicine be thy food. But as physicians, as I said earlier, we're not trained in this. So even the National Cancer Institute, if you look at the National Cancer Institute website, it points to nutrition to help patients tolerate the treatments better, right? Not nutrition as a therapy in itself, right? And so what they're saying is that eat relatively better so that, you could have more chemo and more radiation, right? But not that it's going to be a treatment in itself. And I think that's the focus of one of my 7 key principles, is that nutrition is a therapy in itself, right? It's a therapy in itself. And how many times have we heard patients were diagnosed, they were told the bad news, of their prognosis, and then they thought about nutrition, they made the necessary changes, and the next time they went to get a checkup, the tumor was significantly smaller. Just that in itself, just that in itself. I have an interesting story, and I'll say it briefly, is that when I was 38, my PSA was 1.86. And that's considered normal. PSA is a prostate-specific antigen, which is it's a marker for prostate health. And so normal range is 0 to 4, and mine was 1.86. So conventional medicine would say that's perfect. But I read a big study in China, of over 40,000 patients. And they said that when you're under 40, your PSA should be less than 1. And when you're under 50, it should be less than 2. So it goes up 1 point for every decade. So I said, wow, my PSA should be under 1, and I'm at 1.86. So what did I do? I changed my nutrition. I stopped all meats, and I retested my PSA in 1 month. And I kid you not, my PSA was 0.9.
Wow.
0.9, just with nutritional changes. And remember, my dad had prostate cancer, so prostate health is dear to me, right? And so that was convincing evidence for me at a very early time in my career. And so if you have any specific questions on nutrition, I'd like to answer it. But the fact is, we need to chew our food well. We need to bless our food before we eat it. We need to cook it with love. We need to not be on the phone or the laptop or watching TV when we're eating. A dinner or food it's a social thing. It goes back generations, how this was part of the day, right? The coming together, the relationship with your family. And so it's really a sacred time when we're having a meal, but we've gone away from that, obviously now. And so don't drink water or fluids when you're eating. Drink your, beverages before or after the meals. And so those are, some basic principles. Make sure you're making healthy choices. Don't let nutrition stress you. I know when patients leave Hope4Cancer, the first week, it's like, oh, even though we've educated them, we have educational films, we have a nutritionist on staff, he's wonderful, all these things, but then they get home and what do I do,
Right.
Yeah, one patient said, oh, before I came to the clinic, I redid my pantry so when I got home it would be perfect. I said, what did you do? She said, I put my canned foods on the left side and my non-canned on the right. I said, oh, we got a lot to talk. Yeah.
Yeah, and I know I watched a recent video that you all did, which was great, and I'll share it too. And that was sort of as you took people through your facility. And I remember there was that little section where you've got this, very robust juicer. And I'm sure people think, man, I wish I had that juicer when I get home and somebody to juice it for me. So food can definitely be a source of stress, and especially when you are in a state of of illness and you know that it's important and you really don't have, you don't know what to do with it, but you guys have done are doing such a great job in educating people on what to do and how to then incorporate it when they get home. And that's just, like I mentioned, is just so, it's so largely lacking here. And I appreciate that you all focus on that so highly. I know I'm trying to keep this to 30 minutes for you time wise. Can we wrap up with your success rates in terms of survival rates, which I love that you guys are so transparent with this and it's actually on your website, but briefly go through how, and in comparison, and I know that we can't, it's one of those, can't head to head compare with National Cancer Institute, but what are your survival rates? And then ending up with, if somebody is in a position that they would like to know more, what would be the best way for them to do that, to reach out to you guys?
Yes, as you say, Claudia, this is an interesting dilemma is statistics, because in the conventional world, they give one chemo, two chemos, and that's it. And then they look at the results, right? And they've been doing this for what, 80, 90 years. And so they have all this data with the same chemos. Some new chemos have developed, but the success is basically the same, or the results are basically the same. So with us, we're giving 10, 12, 15 different therapies. So it's hard to know, like you said, comparing apples to apple. That being said, recently we hired a third-party independent group to do a retrospective analysis of our database of 400. This was 465 patients, 92% who were in stage 4. What does that mean? That means, they've either failed all conventional therapy, or when they were diagnosed, they were told there was nothing to do for them. And so that's when they come to us. What you're doing with this education series is so powerful, because for people to know that there's options, and to know that even if they choose conventional medicine, always integrate it with these 7 key principles that we talked about. So of these 465 patients, and also for people to be aware of this so they can make a decision earlier on, that they come to us when they're in stage 1, 2, or 3, not in stage 4 when they failed everything. So of these 465 patients, we had a stunning results, depending on the type of cancer. And this is an ongoing retrospective study, so we're starting year 3. And so far, across the board, it's about a 72% 2-year survival, where they had 3 to 6 months, right? And so, and of course, the quality of life, it's like in the 90s, right, of the results. So that was one retrospective study was ongoing. We'll see what happens in year 3, year 4, and year 5. And that really compares to about 25 to 35% in the conventional world, but that's not in stage 4. Those are in stages 2 or 3. Mm-hmm. So it's not really a comparison. And how to reach us? The easiest way is through our website. It's Hope hope4cancer.com, and that's the number for hope4cancer.com. And the phone number, Claudia, is 619-669-6511. So that's 619-669-6511, hope4cancer.com. We have 2 facilities, one in Tijuana, Mexico, which is south of San Diego, California, and the second one where I am now in Paradise in Cancun. Both places, the treatments are the same. The difference is that the Cancun clinic is an outpatient facility, so patients get the treatment during the day and they're able to go back to their hotel and enjoy the beach or whatever they want to do. And Tijuana is an inpatient facility for more ill patients who require 24/7 nursing and medical care.
Wow. And I know that, in that video that I was mentioning that you guys did, just the scenery and I mean, really talking about bringing mind, body, and spirit, you can't get a better view and a better location to really bring all that together. So thank you so much, Dr. Jimenez, for your time and sharing this. I just think it's so important and I'm going to get it out to as many people as I can. Thank you for treating not just the cancer in the patient, but the patient with cancer, and for all of you, all that you're doing and you and your staff are doing for cancer patients and for those who are struggling and don't know where else to go. So I appreciate your time, and I look forward to talking to you again soon.
Thank you for having me, Claudia. And remember, cancer is not a death sentence. So thank you very much.
Thank you so much. Have a wonderful day.
Thank you. You too.